Thank you very much, everyone, for coming along to this afternoon's lightning talks. We just have two lightning talks this afternoon, and then kind of we'll hold questions for the end. In terms of questions, please grab the Smart Card app. There's like a live discussion tab, which I'm sure people have pointed you to by this point. Drop your questions in there, and we'll kind of circle back to those after our talks. So the first talk we have is from Kate Tapping. Kate is the founder of Write the World Notebooks, which she launched in 2019, and she's going to tell us a bit about the story behind it. So please welcome Kate.
Which my introduction, I didn't know what my idea is. But, so I was invited here today to talk about an idea I had a few years ago, and the idea is around taking the act of effective and making it even more effective. The idea is really, really simple, but it has doubled or more than doubled the effectiveness of my donations over the last 4 years. So, thank you. As background, I'm a corporate communication specialist, which means I help companies tell their stories, and I've been doing it for a long time. Probably the oldest person in the room, I'm thinking. And when I was in my early 40s, I had, like, let's not call it a midlife crisis, but I was thinking about the value of my job and what I was contributing to society, and did I maybe want to work for a charity or a not-for-profit instead of in the mining industry. And a friend recommended I read, whoops, we both did it. This book, Peter Singer's The Most Good You Can Do. And in this book, I read about the theory of earn to give. And to me, earn to give meant that someone like me might be best off, rather than going to work for a charity, but taking my privilege, my education, my experience, my knowledge, making the most money I can, and then giving away as much of money of that as I could. And not just giving it away, but giving it away to the world's most effective charities. So I told my husband, oh, I've read this book, this is great. And he was in, yep, let's do it. So we committed to giving away 5% of everything we earned to effective charities. So at the time, my kids were about 10 and 12. And at the end of every month, we'd sit down together, work out what David and I had earned, what we were going to donate, 5%, and we'd go through the list of effective charities and decide who we were going to donate to. And I found it a really rewarding way of giving. I really loved the quantifiable nature of it. I loved thinking, here's $1,000 over here that can help 500 people have safe drinking water for a year. So it was great. And we did that for a couple of years. I'm just going to give up on this matter. Is that right? And then I had this idea, and I had it in the shower because showers where all the good ideas happen, right? And the idea is simple, that we would produce notebooks and we would sell them as a fundraiser, and we would donate all the money to charity. So that was the genesis of Write the World Notebooks. And we have partnered with the Life You Can Save since we launched in 2019. Every notebook we sell is $10, and for every notebook, the full $10 is donated to one of the Life You Can Save's recommended charities. So we give by quarter, so every quarter we choose one of their charities, and at the end of the quarter, we donate the money from all the notebooks we've sold to that charity. So we launched in 2019, and this is the details of our first print run. So I had 6 notebook designs, and I printed 100 of each notebook design, so 600 notebooks in total. It cost me around $3,000 to produce the notebooks, and when they were sold, that triggered a $6,000 donation to the Life You Can Save. So my donation was effectively doubled. This is our first print run, the 6 designs, and all our notebooks have names. So this is the very first notebook, Grow Ficus Grow. Moby Moby. Hibiscus Hype. Tangled Web. Chill Out. And Mellow Yellow. This is an old slide because I actually gave this talk at the Effective Altruism Conference in Sydney in 2019. And at the time, we'd launched the project 2 or 3 weeks earlier, and we'd raised $2,630 for charity. So what's happened since the 4 years since then? One of the things we've done is we've collaborated with artists to do the notebook designs and to donate their artwork. So the first artist I approached was a Melbourne artist called Anna Blackman. And Anna Blackman, she paints these gorgeous, bright, beautiful, big paintings that I've always wanted one and I can't afford one to put on my walls. But I emailed Anna and I told her what I was doing and would she be interested in being involved. And literally within a minute, she wrote back and she said, yep, I'm in. So this one up here, Pia, is the first artist collaboration we did and it's been one of our best sellers. And since then, we've done another 4 notebooks with Anna. Joy, Che, Sandrine, and Rocky Applause. And we have also worked with graphic designers, graffiti artists, photographers. This is a photo by David Wade, who's a Sydney photographer, and he's renowned for photographing sea and sky. So this one is Seagull Strut, and we've got another notebook with we've done with David called Dawn, which is a sunrise over Coogee Beach. We've also done things like our Fearless Girls notebook series, which we have released a Fearless Girls notebook to coincide with International Women's Day, 8th of March every year. So we have 3 Fearless Girls notebooks. And in that quarter, we donate the proceeds to the Fistula Foundation, which is one of the Life You Can Save's recommended charity helping women who've suffered a childbirth injury fistula. And we've done things like this notebook, which is Red Gum, where, you know, like this effective giving is giving with your head. Sometimes you just want to really give with your heart. So when there were the Victorian floods last year, we did this notebook, especially for the floods. The notebook was still $10. We still gave $10 to the effective charities recommended by the Life You Can Save, but then we matched it with another $10 to the flood appeal. So here we are, 4 years later, we've got 49 notebooks on our website. Notebooks are really good for a project like this because you can produce them here in Victoria. They're flat, they're light, so you can post them easily all around Australia. They make good presents. They lend themselves to the different covers and the different designs. They're all printed on FSC certified paper. And when you finish with your notebook, you can put it in the recycling and it can be made into another product. So I don't feel like we're contributing to sort of plastic tap and unnecessary wastage. So if you remember the slide from Sydney where we donated 2,630, 4 years later we've donated, it's actually over $118,000. This slide's a week or 2 old, which that's a lot of notebooks, right? Ben asked me specifically to talk about the challenges of doing a project like this. And for me, there is absolutely no doubt that the greatest challenge is spreading the word with zero marketing budget. It's taken quite a bit of work, but we have got coverage in some really good publications like The Good Weekend, The Age, The Herald Sun, The Film Review. This one here is, does anyone know Take 5 magazine? So this article here was in the same issue that had Cat Poo Led Me to Love. But, you know, any publicity is good publicity, right? One of the greatest ways for us to spread the word about the project is through just word of mouth and our customers telling their friends and family about the notebooks and the project. So if you're interested in this idea, there's a bit of a sliding scale of involvement. So thank you for coming today. That's like really great that you came and listened. And we are on social media, on Facebook and Instagram. So if you follow us, we release our notebook designs. We talk about the charities we're supporting. If you ever see one of our posts and you think, oh, that's kind of cool, if you share it with your network, that's reaching people that we can't reach. So that's great. And you can, of course, buy notebooks. They make great gifts. There's only 93 days till Christmas. So there you go. And also, if you'd like to take up that opportunity to have your donation doubled, there is the opportunity to sponsor a print run. So say, for example, you donated $250. That would be 50 notebooks, would end up in a $500 donation and sliding up from there. And that's it.
But next up we have Chetan. Who is the co-founder of, and I haven't done my research properly yet, the co-founder of ansh or ansh, gotcha, which is an early stage charity launching its pilot program to build neonatal healthcare capacity in India to save newborn lives. So over to you.
Just to add a little bit more context, we just got incubated by Charity Entrepreneurship Incubation Program in April. So we are super early stage, just out of the program. And I'm going to use my laptop. So yeah, this talk is basically going to be about one, how can I get the clicker?
And she should be right.
Cool. So in this talk, I'm going to be mostly talking about the barriers CE program, the Charity Entrepreneurship Incubation Program, helped us through, and the second, the experience of starting a charity in the first 6 months. Tomorrow there's a talk by Aiden, who's going to be talking about how to tell whether you're a good fit to start a charity, and he's going to be covering how the program helps potential founders more in depth. I'm just going to give you an overview. So the hook is, thinking about getting a charity off the ground can feel a bit like an obstacle race and a really complicated one. Some people might just assume they're not a good fit for this race. Others might look at the course and go like, maybe golf is better. And the last camp is people, they look at the course and they start training. I was in the last camp. And now don't get me wrong when I say starting a charity is like a race. We're not competing against other charities. We're competing against economic forces such as limited time, money, and the counterfactual of starting a charity. Me and my co-founder could easily be working for a proven charity, which we know would have impact, but we decided to take this bet. Next slide. So yeah, CE. So we got incubated the CE program, as I mentioned. This program didn't just help us train for starting a charity, but also helped us through the first 100 meters of starting a charity. And they helped us reduce barriers, such as providing us the toolkit, the skills and knowledge necessary to start a charity. Some that were really useful, which I'll show you the examples of, were cost effectiveness analysis, weighted factor model, knowledge of monitoring and evaluation, and a theory of change, which is probably the Bible for us, I guess. Then it was funding. When you're just starting out, there's very less risk capital available in the global health kind of space. So doing fundraising as a person just entering the space can be really hard. So CE has like a funding circle which supports early stage founders and takes a bet on them based on the training and the experience they have in the CE program. Then it's mentors. So finding diverse set of mentors within your limited networks can be really hard, but CE community has mentors from all these different functions and all these different experiences. Some have started charities, some have worked for foundations. So that has been really useful for us. And co-founder, that's a pretty important one. Doing it alone, starting a charity alone with your limited skill set can be quite daunting. And doing it with someone who has your complementary skill set can make it a bit easier. And now a metaphor I would like to use to why this is really important is, imagine being in a relay race and the person you're working with is slow, or the person behind you is not well coordinated with you. They just throw the baton at you. So that won't really work. So, and it would really affect the outcomes. Same goes for the charity. And then last one is the good ideas to work on. So finding an idea, charity starts with an idea. So I guess what CE program does is they do hundreds of hours of research on many different ideas and narrow it down to 5 or 6 ideas every 6 months. We pick one of the ideas, which is an intervention called kangaroo care that is proven to save newborn lives, but it has barriers in implementation, which we're trying to solve through this charity. I won't talk a lot about the intervention itself. Next slide. You can go to ansh.health and have a look in more depth about the intervention. So yeah, now we had all the tools, resources, everything to start a charity. Now comes the execution. This is what we have been able to accomplish so far with all the tools. So yeah, we selected to work in Rajasthan, for which we had to use a geographic analysis, and it was a really hard decision to make. Sounds really simple, but we'll show you the examples. We were able to secure partnerships. We've hired 2 staff and got government approvals to work in 3 healthcare facilities, which is again like a long process. And yeah, we've established an advisory panel to help us with different decisions. Now, there's 2 main areas of learning we have had so far, which is one, making good decisions is extremely important. That's one of the core parts of the job as a charity entrepreneur. So for some decisions, you have to slow down, and some decisions you can take really quickly. I'll show you some examples of decisions we had to slow down for. And even then, we're not really sure about if we did a good job. We'll only find out. And second is that, sorry, next slide. And second is that using existing research is like existing research is really helpful. A lot of RCTs tell you something about the intervention, but replicating it is really hard. So you do need to deal with a lot of complexity and diverse set of stakeholders to really make it happen. And that's what we're experiencing so far. So I'll try and explain these 2 learnings a bit better in the examples that I give you next. So this is the geographic assessment we conducted to choose where to work. We compared all these different countries, and then we found out that some states in India, so states in India are a bit like a country in Europe. So we realized some states in India have higher mortality rate and higher potential for impact than some of the countries. So we decided to work in India because there were 4 states, and both of our co-founders had an exceptionally good fit to work in India. Next one would be, yeah, so now came the decision to choose between the states. And this is where our existing research tools kind of failed us, because getting that data for each of the individual states meant 40+ hours of work, building relationships from scratch with each of the stakeholders. And that was a really big job. I've been told that I have very less time, so I'll just quickly go through the spreadsheet. This is how we chose what partner to work with in these states. This was just the criteria and all the proxies we used. And next one, this is our cost effectiveness analysis to help just estimate what is the kind of impact for the costs we've had. But a lot of this data is very uncertain. It's based on research. Once we actually go on ground, we'll find out how much of this is true. Yeah, so there's a lot of uncertainty when you have to deal with a lot of uncertainty as a charity founder. But what motivates us is the potential. This is again based on assumption. In the first year of operation, we might be able to save 80 to 100 lives for about 2,332. Can we see the next slide? Yeah, that figure. Yeah, and yeah, just the last thing I want to add, which is just concluding this session. I saw the yeah, so I guess key things that we are trying to keep in mind as a result of these learning, we have to be adaptable. Research and your plans will tell you something, but we have to change them. You have to focus on testing and piloting first, rather than optimizing on perfecting your decision, because there's always limited information and limited time. And last is, yeah, just embrace uncertainty. That's part of the job description. And yeah, your job as a charity entrepreneur is partially to navigate through the uncertainty with whatever tools you have. Yeah, that's.
So we've got about 5 minutes left in the session, and then I think we've got afternoon tea. So Kate, if I could bring you back to the stage, we'll do a lightning talks, lightning questions. So maybe actually, Kate, just starting with you, interested to hear your take. These points on like charity entrepreneurship. Do these kind of resonate with kind of the private entrepreneurship that you've done?
Be adaptable. Definitely, but one of the things about just being pretty much myself is I can make the decisions and then act on them, and I don't have to ask anyone for the permission. I don't have 40 stakeholders. So I would say I'm in a much simpler position in that perspective.
Yeah, cool. And Chetan, kind of on this stuff, was this all stuff that you kind of learned through the charity entrepreneurship thing, or like did you build those skills some other way? Like how did you go about all of that?
Yeah, I guess before starting this charity, I've worked for Fortify Health, which is another global health charity, where I saw some of these experiences pan out in real life before I actually got into this. So I sort of knew the life I was signing up for. Before that, I've worked in diverse areas, like I've worked in the government, so I know a little bit about what it could look like trying to get permissions from them. So yeah, I would say I was kind of prepared for it, but when you do it, you realize it's all at the same time, not one by one.
And Kate, kind of how did your experience kind of prior to notebooks, how did that kind of support, or like what did you have to like learn in a hurry to do that?
Well, I guess taking the first bit, what I had done in the past that helped was, I've always worked with, photographers and designers. I was used to marketing things. The things I had to learn was I had to learn Squarespace and set up my own website. And don't laugh at me, but please don't laugh. You can laugh at me. I wasn't on Instagram or anything like that. So I had to learn social media to market that. And so my team helps as well.
I'm also still not on Instagram, so
Right.
Also, there we go. And so could you go into a bit more detail about how you got the word out for that initial notebook run? Like what was that story like for the kind of the first one?
I have to cast my mind back 4 years, but with something like this, I think it really starts with family and friends. And so you're telling your own networks and relying on that. And then once you exhaust that in the first month or so, and all your family and friends have got your notebooks, then you have to think of, how do you route one?
Any reflections, like interested in your reflections as well, Chetan, on like in terms of like getting to those stakeholders? So I guess it's like there's a little bit of symmetry or comparability where it's like because you don't have stakeholders, but you have like a market. So it's like it's always you have way more stakeholders, right? It's like it's every consumer. But then kind of what was your experience with convening those stakeholders? Was it like there were a few that were easy and then you kind of got like harder and harder, or what's that been like?
Yeah, so I think we are working in the public health system, and to get permission from the government as a new non-profit, it can be challenging, especially going up with, hey, we have no experience, but we would like to set up this really important thing which is going to potentially deal with lives of people. So that can be hard. So how we went about it was we have implementation partners which have pre-existing relationships. We are essentially on the technical program design side and monitoring the whole intervention, while the implementation partners helped us with the relationships. So we took like easier pathway. But once we have a proof of concept, we hope to be able to reach to the government stakeholders directly. And another thing I just want to add on the stakeholders front is that so far we realized that all these different stakeholders will come with their own sort of incentives. So what we are trying to do is, okay, we want to focus on saving human lives. But one stakeholder wants to do that, but also cares about how the public health system is going to look. We do have to deal with lots of different expectations and try to frame it in that way. So it can be challenging.
Makes sense. Cool. I think that's about all we have time for, but I'm kind of speaking on your behalf. So I'm sure Kate and Chetan would be happy to talk more after the session. Getting nods, yes, okay. So catch them at afternoon tea, message on swap card. I think I probably will. So thank you once again for giving these talks. Please join me in thanking Kate and Chetan.